Hi everyone, welcome to today's episode. As more and more of you have been watching these videos, we are now getting the questions coming in thick and fast. And another question from one of our viewers is, what causes migraines? How do they come about? How can they be either prevented or treated? And really, are migraines a lifestyle condition? My name is Dr. Dennis Nturibi, and welcome to Eat, Live and Be Well. Migraines. A migraine is a type of headache. So in the medical fraternity or in medicine, we define headaches by their characteristics, sometimes also by their causes. And in defining headaches, you can have one of the categories is migraine headaches. Now, what are the characteristics of a migraine? A migraine is often a severe headache, a significant or severe headache. It has causative trigger factors. So for people who have a history of migraines, they know what triggers migraines to happen in them. And what they describe is that they have a headache, typically that involves one half of their face or head. And many of them will tell you they feel as if their eye is being pulled out, or as if the pain is right behind the eye. But most of them will tell you it is one half of the head. The trigger factors depend on individuals, but there are some that are common between individuals. One of the commonest trigger factors for migraines is stress. So people who have migraines will tell you that when they have stress, either at work or at home, or just personal stress, maybe dealing with a medical issue and they're worried about the outcome and such things, then they know they can get a headache. A common trigger for headaches is for other people is noise, okay, or excessive bright lights. Petrol or gasoline fumes trigger headaches in some people. For other people, there are specific foods that can trigger the migraine headaches. And therefore, of course, for them, one of the most practical ways to avoid the migraine headaches is to avoid the triggers. For example, I know someone who, every time she goes to fuel her car, if the windows are open, she's going to get a migraine an hour or two later. So when she goes to the petrol station, she has to give instructions and close all the windows and doors so that the petrol fumes don't come into the vehicle. Now, once a migraine starts, a lot of individuals with migraines have noticed that if they go somewhere quiet and dark, that the migraine subsides. So usually they want to go up to the bedroom to lie down, put off the lights or close the curtains so the room is dark and have no noise. And often the migraines will subside. But of course, that does not work for everyone. It really depends on individuals. Migraines are commonly treated with simple painkillers like paracetamol, which are over the counter. They're also treated with prescription painkillers. And then there's specific medications for treating migraines that are given either to prevent the occurrence of a migraine or to kill the pain once a migraine has started. If you're one of those people who gets a migraine 2, 3, 4 times a week, that can be very debilitating. You might find it impossible to function normally, and you might need to go into preventive treatment for the migraine. Of course, a big question, and especially related to our channel here, is, are migraines a lifestyle condition? And the answer is yes and no. No, because they are not exclusively brought on by lifestyle choices, but yes, because the severity of having migraines, the frequency and severity can be managed by making the right lifestyle choices. So commonly, you find, for example, people who smoke or take alcohol in larger quantities might get more migraines than they would otherwise get if they were not doing that. There are certain foods which we like eating that are probably not that healthy for us, and therefore an individual who has a history of migraine headaches might be getting migraines 2 times a week. They change their lifestyle and they find they're getting a migraine once a quarter or once in half a year or 6 months period. Therefore, lifestyle plays a significant component. Everyone who has a history of migraines will tell you when they're stressed and they don't sleep well, their migraines flare up. So rest is a significant component of managing your migraine conditions. Therefore, we would like to welcome you to walk this journey with us. Join us at Eat, Live and Be Well. Like our Facebook page, subscribe to this channel, hit us up on Twitter, or just give us a phone call, and we'll walk this journey with you. We have our different products. We have our basic lifestyle consultations. We have the intermediate lifestyle consultations, which involve a number of tests. And these consultations help you to understand where you are as an individual on your lifestyle spectrum, and especially what changes can be made. And for those of you who are serious about making a change, we welcome you to our 15 session program, where we'll educate you and walk the journey with you to attaining and achieving good health. Thank you.